So now I'd like to pivot a bit, and Stephanie, I'd like to start with you. Can you describe a teaching moment that stands out as exemplifying your experience in the program so far?
Sure. So in radiology, we do something relatively unique, and we have what's called tumor boards. And so when lots of surgeons will come in and have a meeting, and there'll be radiation oncologists and medical oncologists and nurses and nurse practitioners and the radiology and pathology departments. And we have a big meeting about patients who are undergoing treatment in different ways for their cancer, and they're in different stages of that treatment. And a lot of discussion is, how bad the disease is, is it getting better, is it getting worse, what's our next step? And the radiology resident is pretty integral in those meetings. And so we show the images for each patient and compare them to their last scan and to their most recent scan. And the attending is with us, but we are sitting there, talking directly to the surgeons and the clinical team. And it can be very challenging if you're uncomfortable with kind of describing the imaging and doing things on the fly. And so I think having those experiences in the tumor board has really taught me to be independent and confident in what I'm describing. But at the same time, I have an attending there who will step in if I have, any troubles or say something incorrectly or don't know the answer. But at the same time, I can, just go for it and know that I know what I'm talking about and give me some more confidence for the future.
So it's about learning more of those soft skills and those hard skills.
Right. But still having the support behind you just in case.
Okay, thank you. Now, Tess, do you have a teaching moment?
I remember specifically there was one night where we had like a super busy night, and I had gone and I had delivered, or I had called the attending, and I told him one of his patients was going to deliver. So he came into the hospital, he like woke up, he came into the hospital, and at the end, we were walking through some things and the delivery went really well. But he kind of at the end pulled me aside and he was like, "Oh, I have some tips for you." And it is like 3 o'clock in the morning. The only thing he really wants to do at this point is go to bed. But he spent a solid 30 minutes sitting there, like walking me through some just like tips, some like pointers, some like ways to help, deliver a baby better, like the position of the baby and things like that. And it was just really, I think it was like a really cool point in residency to have somebody who was just willing to, like, even though he had to work the next morning and, like all the time, nights is not always the place to be doing excessive teaching. He was still willing to, pull me aside and be like, this is something that you could learn from the situation. And I thought that was a really cool, teaching moment that stood out to me.
Yeah, I can agree with that. It's always helpful to have more supportive superiors, especially, when it's 3 o'clock in the morning. It's always more helpful to have that support in the workplace than it is to not.
I think we get really good support here at Creighton. And I think that's one of the things that I've always really appreciated about this program a lot.